Scano, good day, ladies. Thank you for joining us again on another edition of COVID-19 podcast series. To introduce, we have here with us Lori Davis-Hill, Director of Health Services, and Lacey VanEvery, Acting Nurse in Charge at Gagnios Health Center. Without further ado, ladies, I'll turn it over to you.
Hello, good day. Thank you for joining us today as we provide you with important COVID-19 vaccine information. Community transmission is widespread everywhere at this time. Variants are pushing our healthcare system to its limit, and our healthcare workers are exhausted. Younger people are getting sicker and need life-saving treatment more often. It is important than ever that we take this disease seriously. We all have a responsibility to protect each other, protect our communities, and protect ourselves. We want to talk to you today to discuss the importance of maintaining public health measures as vaccine programs expand across the country. We also want to provide information about the development of the COVID-19 vaccines, how they work, and what we know about their effectiveness and safety. The Government of Canada and the Province of Ontario are working diligently to distribute vaccines to the most vulnerable populations, including those in 6 nations of the Grand River. Your community health team is working around the clock to ensure those vaccines are distributed as soon as we receive the doses. We are in a race between vaccination uptake and the spread of variants, which threatens to overwhelm our healthcare system as a whole. This is a race we cannot afford to lose. I want to turn it over to Lori.
Now, Lacey, let's chat a bit about the importance of maintaining public health guidelines. Vaccines have given us hope for a return to normal life, but we cannot let our guard down just yet. The variants are here in our community. When numbers are low, we have seen that people let their guard down and start to branch out to visit family, host gatherings, and dismiss public health guidance. The number of high-risk contacts tied to variant cases is growing, in addition to our overall cases. Variants transmit even faster and more easily and can cause more severe disease in younger people and those without health problems. We must continue to do everything we can to stop the virus's spread by continuing to follow all public health measures. This means getting tested for COVID when you have any symptoms, even mild ones, or feel you have had contact with a positive case. Here are some things to remember. If you are experiencing symptoms or public health has asked you to isolate, make sure you stay away from all others, including people in your own home. While this can be hard, it is far better than infecting your loved ones and risking their lives, as it is impossible to predict how COVID-19 will affect each individual. It is also critical to avoid close contact with anyone outside your household. Wear a 3-layer, well-fitting mask when you cannot stay more than 2 meters from others. This is critical indoors, but with highly contagious variants in our community, it is just as important outside. There have been cases of people being infected at barbecues and other outdoor gatherings because these new variants spread so easily. Wash your hands frequently with soap and water or use alcohol-based hand rubs. Get vaccinated as soon as you can to protect yourself and those around you. Encourage your family and friends to get vaccinated too. The more people who receive a vaccine, the safer all of us will be. Back to you, Lacey.
Thanks, Lori. COVID-19 vaccine bookings are now open for everyone 18 years old and older. The COVID-19 vaccine clinic is now open for community members, their families in the territory, and those working in the territory. To book an appointment online, you can visit www.sixnationscovid19.ca. You can also call 226-227-9288. A complete list of May and June clinic dates can be found on 6 Nations of the Grand River online channels. Please share this information and help those around you. We are aware that some of you may have questions about COVID-19 vaccines and wonder if you should get vaccinated. We want to empower you with clear, understandable information that will help you feel more confident with your decision when the time comes. Lori?
Now let's turn our attention toward the vaccine development process. The COVID-19 vaccines are safe, effective, and reliable. Since December 2020, Health Canada has approved 4 COVID-19 vaccines, all of which underwent a rigorous authorization process. Approval decisions are based on scientific and medical evidence of safety and effectiveness. In order to be approved, evidence must show that the benefits outweigh the potential risks. This evidence isn't just being assessed in Canada. The COVID-19 pandemic has impacted countries across the globe and created an urgent situation that has resulted in scientific and medical collaboration from many countries all at the same time. This shared pursuit involved unprecedented amounts of funding and the ability to run trial phases efficiently and effectively. While the speed at which the COVID-19 vaccines were created is astounding, safety and the integrity of the scientific process was not compromised. Studies took place in North America, Europe, Latin America, and South Africa, with almost 130,000 people participating in trials for the 4 approved vaccines. To date, more than 329 million doses of the vaccine have been given worldwide, with more than 73 million people fully vaccinated. In Canada, over 12 million doses have been given, with over 800,000 people fully vaccinated. After a vaccine has been approved in this country, Health Canada continues to monitor and review its safety and effectiveness through a collection of data from provincial and territorial public health agencies, manufacturers, and other sources. There are procedures in place for rapid assessment of any potential risks, and Canadians will be updated as needed. This includes new information on risks or changes to who can be vaccinated for COVID-19. Lacey?
Many members have asked the common question around how does the vaccine work? The Moderna and Pfizer vaccines are both messenger ribonucleic acid or mRNA vaccines. They teach our cells how to make a protein that triggers an immune response. Our immune system will produce antibodies which protect us from getting infected if the real virus enters our bodies. The Moderna and Pfizer vaccines will require 2 doses to ensure a robust immune response and fully effective immunization. There have been instances of people being infected after only receiving 1 dose. So remember, you are not fully protected until you have received both doses. In addition to the question around how the vaccines work, another common question is around the side effects of being vaccinated. None of these vaccines will infect you with COVID-19, nor do they affect or interact with your DNA in any way. You might experience side effects as your body works to build immunity against the virus. Common side effects include a mild fever, muscle aches and joint pain, fatigue, and temporary redness or swelling around the injection site. Rarely, reactions can include a higher fever or an itchy rash at the injection site. There is also a small risk of an allergic reaction, which is why your healthcare provider will ask you to stay in the clinic for at least 15 minutes after vaccination to monitor you. Some people have experienced more pronounced side effects when receiving the second dose of their vaccine. The risk for more adverse side effects is very low, and vaccination is one of the most effective ways to protect yourself, your family, and your community against COVID-19. We also want to remind you that the COVID-19 vaccines do not work immediately. It takes up to 3 weeks for your immune system to respond and provide protection. The COVID-19 vaccines are not 100% effective. Although immunization will greatly reduce your risk of becoming infected with COVID-19, there is still a small chance that you can become infected even after being immunized. The vaccine can protect you from getting seriously ill, but you could still spread it to other people. If someone is exposed to the virus in the first couple of weeks after vaccination, they would not be protected and could still get sick. This is not an adverse reaction from the vaccine nor a failure of it, but rather unfortunate timing. This is why it remains critical to follow the public health measures, even after receiving your vaccination. Our children are not yet eligible to receive the vaccine, so please continue to protect them by following the public health measures. If you have any questions, please call your healthcare provider or Shwegen Public Health at 519-445-2672. Lori?
So a reminder, the Six Nations COVID-19 vaccine bookings are open for everyone 18 years of age and older. The vaccines are now accepting walk-ins for members. members' families living in the territory, and for those working in the territory. If you want to book an appointment, you can do so by going online at www.sixnationscovid19.ca, or you can call 226-227-9288. Please share this information and help those around you who might need assistance to register. We are also aware that some of you may have questions about the COVID-19 vaccines and wonder if you should get vaccinated. Through these podcasts, we want to empower you with clear, understandable information that will help you become more confident with your decision when that time comes. Lacey?
Again, now go to our frontline workers and to everyone doing their part to protect the community from the spread of COVID-19. Thank you all for your dedication to protecting each other while also protecting yourselves. This pandemic has tested our limits in countless ways, but the important thing is that we continue rising above the challenges. We have overcome so much and we will continue to do so. If you need support, community resources are available to you. We are strong, we are brave, and we are united in this battle.
Now, my ladies, for providing this information. I hope the community will find this informative and help clear up any misconceptions as we continue to work to keep everyone safe during this pandemic. Now, again, stay safe. Ona.
Jonah.
Ona.